The first thing to discuss in terms of treatment for this is when it becomes time to fix an aneurysm, or at least consider contemplating fixing it, there really are no options other than surgical. Historically, the surgical repair of this was done through a transabdominal approach, in other words, a long abdominal incision. This operation involves hand sewing in a Dacron graft, and these grafts have been placed for the repair of these since the early 1950s. In fact, it was Weinstein's rupture that the first repairs of these aneurysms were being performed in this country. And since that time frame, the repair has involved utilization of Dacron fabric, which is basically a polyester fabric. And these repairs have been done with this type of material for now 50 years in this country, and the material is very durable. The repair itself, however, is somewhat of a formidable operation in terms of from a patient perspective. It involves a long abdominal incision. It requires almost always being asleep under general anesthesia, and basically what we do in this repair is once we get in and we get control on the blood vessels that feed the aneurysm, the main aorta, and then the iliac arteries below it, is we actually open the aneurysm and basically hand sew a graft, again this Dacron material, into the aorta, typically in just below the kidney arteries, which is what this is showing. In this, these are the kidney arteries in this picture, and then it's typically sewn down to the lower part of the aorta or to the iliac arteries. A few more comments about that. The operation, again, has been done now for about 50 years or so. It's a very effective operation at what it's designed for, and that is to eliminate the risk of rupture. And in fact, it's extremely effective, and most surgeons believe that after you've placed one of these grafts, that long term you've really cured the problem. Now, prior to this lecture, I will tell you that two people from the audience came up to me and had personal questions about the development of aneurysms subsequent to one of these repairs. And indeed, that can happen. People who develop an aortic aneurysm are prone to weakness in their arteries, particularly the aorta, and indeed the other sections of the aorta can weaken over time, and the person can develop another aneurysm. And for example, the two individuals that came up to me earlier had a number of years following repair of their aortic aneurysm had developed what sounds like another aneurysm even above it, and that would